Hi, I'm Dr. Topi Laaksonen.
And I am Professor Yrjö Nietosvaara from New Children's Hospital, Helsinki, Finland.
We are discussing our jbjs article, Epidemiology, Treatment and Treatment Quality of Overriding Distal Metaphyseal Radial Fractures in Children and Adolescents. What led us to do this research?
We were inspired by Crawford's study published in jbjs 10 years ago and treated some less than 10-year-old children with overriding radius fractures without reduction in synthetic above elbow splints applied in finger trap traction in ER with amazingly good results. And what has been the traditional method of treatment of these distal radius fractures in our institution?
All fractures have been traditionally reduced either in ER or in OR. Most of our attending pediatric orthopedic surgeons used to prefer pin fixation. What findings of our study surprised you?
I was surprised that there was no obvious deformity present after cast removal. However, the injured wrist looks a bit thicker compared to the uninjured wrist. I was also surprised by the speedy return of normal forearm and wrist function in my patients. What about you? What surprised you?
I was surprised at the high rate of failed reductions in ER. And secondly, pin fixation does not seem to be easy to perform.
Should we change our practice based on our results?
It looks like these fractures in prepubertal children are best treated without reduction by casting in ER, because these can be done fast and safe without anesthesia and opioids. Furthermore, results seems to be as good as traditional methods.
What remains the most important question unanswered by our study?
We do not know what is the age limits or skeletal maturity stage when no reduction is still a safe option. Do you have anything to add?
I do, Topi. We do not know if above elbow splints are necessary, although we believe they are better than below elbow splints or casts in reducing pain during the first couple of weeks after the injury. And finally, I would like to tell you all that we have started a randomized controlled trial in order to compare casting without reduction to pin fixation. Thank you for your interest in our study.
And same in Finnish. Kiitos mielenkiinnosta ja morjens!